Hey guys, welcome back to Medical Coding with Blue. Today is Q&A Tuesday. So if you're new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love what I do, and I created my channel with the hopes of sharing all of my experience with all of you. I take all of the questions that I get from comments through email and by Instagram, and I share them all on one episode, which is called Q&A Tuesday. So if you're interested, I hope that you'll hit that subscribe button. I hope you'll hit the share button at the end. If it really helped you, it could help others. And I hope you'll give it a thumbs up. So let's get started. Okay, so thank you to everybody who submitted a question. I really appreciate it because this tells me what you guys are thinking about. Okay, first question. Why do some employment listings ask you to have ICD-9 knowledge? Okay, so sometimes when you are looking for a job as a medical coder, it will say that they want you to have knowledge of ICD-9, comma ICD-10, and you know, what do you make of this? We are no longer in ICD-9. That is completely done away with. That is no longer valid. What happens is, sometimes these employment listings are written by people who are not medical coders, okay? They are just written by somebody in HR or maybe somebody that doesn't really have a full grasp understanding of what we do. So they say, okay, well, you know, we just want you to sort of fill this in and just get the word out that we need coders. So they think, oh, okay, well, ICD-9. Even though that's not what we do now, it's ICD-10. So if you see that, it's just because a person who perhaps wrote it doesn't know about what medical coders do, and they're just somebody that's just getting the listing out. So again, we are in ICD-10. ICD-9 is no longer valid for coding purposes. So just disregard. That would be what I would advise anyway, because we don't use it anymore. Okay, those books are not even being published at all. So we are in ICD-10. All right. Next question. Do you have to bring your books with you when you are going to an interview? So the books being your diagnosis book and your procedure book. It just depends on where you are. Sometimes but they will let you know if you're going to need to bring your books, okay? They may ask you questions when you're in the interview process, and they may ask you, you know, well, what section is this in, and what section is that in, or whatever. When they are giving you an assessment, though, you will be allowed to use your books. And every place that you apply to be a medical coder is going to give you an assessment because they need to gauge your knowledge, whether you are a veteran medical coder or a brand new medical coder. So it really all is going to depend on who is interviewing you. Sometimes during the interview process, they don't want to talk about coding. They just want to get to know you. They want to get to know who they are potentially hiring. So no, you wouldn't need your books at that point. But you can ask them, do I need to bring any books or any materials with me to this interview? That's just a very simple question to ask. Okay. Next question. I've been thinking about going to school to be a full coder to get some extra part-time work. That wasn't a question, but it's more of, I need to clarify for you all. Medical coding is not part-time work. Period. If you are brand new and you have no experience being a medical coder, you will not get a part-time job. You will not get a remote coding job because you have to have experience in order to get those things. Medical coding, when you get into it, is very demanding. It is a full-time job, okay? There may be employment listings for PRN or as needed, but that's usually for people who've had experience as well. So don't get into this. Don't get into medical coding thinking that it's going to be something that you can do part-time or in your spare time right away. That is really generally reserved for people who've had experience, okay? When you are working part-time, they are going to expect you to be working. You cannot be sitting there asking lots and lots of questions as a new medical coder would. New medical coders are going to ask lots of questions because there is a huge difference between book coding and real world coding, okay? Doctors and providers do not write like the book, okay? They're going to write like they want to write, especially if they haven't had training from a very good hands-on medical coder. So that is just something to keep in mind. No, this is not part-time work, and no, you cannot do this in your spare time. If you are wanting to get into medical coding, you need to be committed to it, at least in the beginning, while you are learning it. And that's just my thoughts on that one. Okay, next question. Do some coders wear scrubs? So it depends on where you are. Some facilities do allow their coders to wear scrubs. The first two places that I worked, they did allow it. This current place that I'm in, the facility that I'm in, they do not allow coders to wear scrubs. It's just the healthcare staff that is actually being hands-on with patients that are allowed to wear scrubs. We are supposed to wear just, office business casual, office wear. That is what we wear. So it's really going to depend on the facility that you're at. That is a question that you should ask, okay? Because it is important to know. The next question sort of ties along with it is, what are the dress codes? Are piercings allowed or colored hair? Okay. I'm going to say this, and I'm going to be very blunt. You are in a professional work environment. That's number one. Okay. Number two, how you appear. And yes, while it may be superficial, and I'm probably going to earn some dislikes for this one, but that's okay, because at least somebody told you. All right. Now I'm going to tell you, and I'm going to be honest with you. You need to instill confidence in the people that are coming to you as the medical coder, right? And in order to do that, you need to have an outwardly very professional appearance. I do not care if everybody in your department wears jeans and t-shirts, because I've known some people who wear jeans and t-shirts, and I've known some people who have a shirt that says free hugs, and that's what they wear to work. No, ma'am. When you are working in a professional environment, you need to be professional at all times. It does not matter if everybody else is wearing jeans and t-shirts. You need to be very professionally dressed. You need to make sure that you are not wearing blue jeans. I cannot stand when I see people in a professional work environment wearing blue jeans. If you have piercings, again, you are working with very highly intelligent professionals, doctors, nurses, anybody else. You're working with very, very intelligent people. If you have facial piercings that are like a lot, like all over your nose and your eyebrows and your lip, come on, guys. This is not the time for that in the workplace, okay? If you have colored hair, again, I'm going to be very frank and honest with you. If it is not a natural hair color, you don't need to have that in the workplace, okay? You need to look professional. Your hair, yes, while it is a outlet for creative expression for some, it needs to be a natural hair color so that they can take you seriously when you are in the workplace. Now, I'm not saying to change your creativity and how you express yourself and things like that. Everybody should be free to creatively express themselves. I am very creative as well. But when it comes to being in the workplace, you need to dress the part. If you want people to take you seriously, you can't go in there with colored hair that is some wild hair color, because I've seen wild hair color, and I've seen it on people, of all ages, and they think that they look really cute and everything like that. Guys, it's not the place for it. Period. And you want people to take you seriously. You want people to respect you, and of course there's going to be some people that get upset with this and say, well, I have colored hair and I'm respected and I have all this. Guys, I'm telling you the things that's going to make you successful. These are the things that are going to make you successful. And if you have colored hair and you're successful and you're a medical coder, that's up to you. But I'm just telling you what I would advise. If you're brand new, particularly, even if you are a veteran medical coder, up your game and look the part. Be professional. Wear office wear, okay? Well, I don't want to do that. I don't want to be boring. It's not boring. If you take a look at my Instagram, clearly you can dress very nicely and not be ever boring, okay? And I am really smart when it comes to buying clothes, okay? I am going to have to do an episode where I'm talking about fashion for the office. But it probably will be when they let us back into the stores later on. So the thing is, you can be professional and still be smart about the money that you're spending on clothes, okay? You are going to have to be dressing professionally. And I don't care if everybody else around you is not dressing professionally. You don't have to follow the crowd when it comes to that. I didn't. And when I worked in this room, this tin can room with 20 different women, And we were housed away for a while at my facility, away from our providers. But I started to, when I first started, I mean, I would dress up, but I wouldn't take it as seriously because I didn't know any better. And everybody there in the office was wearing jeans and t-shirts. And I started to say one day, well, I need to up my game. I need to start dressing nicely, and I need to start taking this seriously. When you start to do that, you would not believe all the things that start to come together. So when I started dressing up, I started wearing slacks, I started wearing skirts, I started wearing dresses. Dresses is a little bit easier for me because I'm on the short side. I'm just under 5 feet. And so I don't have to mess with the tailor, okay, with slacks. But when I started to do that, you know, the girls would start asking me, why are you getting dressed up? You don't need to get dressed up. Well, why not? Well, I mean, who are you dressing up for? Myself. Why can't you dress up for yourself? Why do you have to dress up for anybody? I dress up for myself. Me personally, I dress up for me because I want to look nice. Because going out and being in the workforce, people are going to treat you differently based on how you are presenting yourself. If you look all very nice and very dressed up, people are going to respect you like that quickly. And then, of course, when you start speaking and you start sharing your knowledge, they're going to have that greater level of respect for you. And that's what you want. I've been in a room before with other coders, and I was the only one that was dressed up. And all the providers gravitated towards me. Why? Because I looked like I was a leader. I looked like I was important to them. And it wasn't until I started speaking that I was like, they were like, oh, okay, well, she knows what she's talking about. And they go, well, Blue, why did they do that with you? They didn't do that with us. Okay, let's look at how you're dressed. Okay, let's look at your hair. Let's look at what you've got going. And some people will get concerned about tattoos. And these ladies had pink and purple hair. I'm just saying. I'm just saying. And some of these people had tattoos too. Tattoos is really not an issue. It's not like from way in the 50s where it was like taboo. Tattoos can be covered up. Okay, if you have neck tattoos, then you're really going to need to cover that up. Okay, because people don't need to be seeing your tattoos. If you've got sleeves, wear long sleeves. Okay, that tattoo stuff is your own personal time away from work. You don't need to be calling attention to the other features of yourself that's not your brain. Okay, and that's what I got to say about that. But going back to being in that room with 20 women, all of a sudden, when I started dressing up and they were asking me, why was I dressing up? Did I have a new man? No, it's not about having a man. It's about me, that I want to look and feel good about myself. And so that way I can do more. Do you know that the other ladies started to dress up too? So I'm just saying, sometimes you have to be the leader of the pack when it comes to changing things. And that's something that I think is a positive change, because when you start to look good and feel good, you start to walk taller and you start to get more confidence. And a lot of times that is something that is very important, especially in the workplace. So again, it's my advice, if you have colored hair, to please change your hair back to an original hair color that is normal to nature. And if you have piercings, you need to take them out of your face. I'm just saying. Okay. Next question. Let's see. Is it true that outpatient reimbursements are solely based on CPT codes? Yes. And of course, the order of the diagnosis codes, like for inpatient, also affect, reimbursements and things like that. But for the most part, reimbursements are based on the procedures and the evaluation and management levels of providers, okay, and what they're documenting. Have you done both inpatient and outpatient coding? What did you prefer more and why? I have had study with inpatient coding, and I have had my whole career is outpatient coding. I prefer outpatient coding only because with the inpatient, the rules are different. And their procedure coding is way different. With outpatient coding, you have one book and it has all the codes that are listed. There's no customizing this code like it is on the inpatient side. I like the clarity of the outpatient setting. What is actually happening is what is actually getting picked up. There's not this guessing game. To me, it's a guessing game There are specific rules to inpatient, and some people really love inpatient procedure coding and inpatient coding. It's really going to depend on the individual. I honestly do think it is a teacher issue, that if you are being taught properly, that you can grasp it a lot better. But like I said, I've only had actual hands-on experience with outpatient coding. I've only had school teaching with inpatient coding. So that's my opinion on that one. But everybody's different. And that's my answer on that one. All right, next question. Can we use online ICD-10-CM to learn, or should I use the books only? If you are studying, you need to be using the books. You don't need to be using an encoder if you are learning how to be a medical coder. Do you know why? Because when you go to take your exam, you aren't going to be able to have an encoder. You have to use the book. You have to learn how to use the book, and you have to look up codes quickly. And so that's the deal with that. Don't get to that point where you're going to be so dependent on an encoder to get codes, because yeah, you can use an encoder, but it's for when you are out in the workforce. It's not for when you're trying to study and learn and be a brand new coder. You need to have that speed with looking up codes and looking up procedures and things and getting familiar with the book, because when you go to take your exam, you're only going to be able to use your book. Okay, and using an encoder is going to severely impact your growth in looking up codes quickly, because you don't have practice. I'm just saying. Okay. Next question. I started a coding class, and so far I've been doing okay. I would like to know, is it difficult to get a remote coding job? As I've said in every single video that I talk about remote coding, and of course it always gets me people that are upset. It's the truth, guys, and I do not have any reason to lie to you. When you are a brand new medical coder, you will not get a job as a brand new medical coder in remote coding, period. You need to have an average, and I say average because every place is different, but the average length of time as a medical coder you already need to be is 3 years. So if you're getting into this because they're promising you that you can be a remote medical coder, they're also not telling you that you're only going to be able to get it after you've had experience. So that's just my advice on that one. The next one is, I'm taking classes to become a medical office specialist. I was wondering if I need to take medical billing and coding classes too. Yes, because a medical office specialist is a completely different function from being a medical biller and coder or a medical coder. You have to have a credential to be a medical coder if you want to be a medical coder. Medical billers do not have to be certified. You just need to have a high school diploma or a GED. But a medical office assistant is going to be completely different. Sometimes in some places, there's going to be like people who have that function, who do like the front office, and they do the coding and they do all of this stuff. But if you are wanting to be competitive and have that medical coding credential, you do have to sit for those exams. Okay, so again, medical office specialist and medical billing and coding is completely different. And then it goes down to medical coding, and medical billing is completely different as well. Medical billers work solely with the insurance company, and medical coders work with the providers on, selecting the codes and things like that. So completely separate functions. Okay, it's not all synonymous. All right, next question. After completing online training, on average, how long do most people spend studying before sitting for a certification test? So it depends on how confident you feel. If you feel really confident about yourself and your ability to be able to pass the exam once you've completed your program, some people wait a couple of weeks and then they go and take their certification exam. I waited about a month after I completed my program to give myself a little bit of extra time to study, and then to take about a week off. I took a few days off, about a week, before I went and sat for my exam, because at that point, you're not going to learn anything new. So I was just giving myself a break before I went to go take my exam. It's really going to depend on you. The longer you wait, obviously, the more you're going to forget things. So you really kind of want to make it not too quickly if you don't feel ready yet, but not too long. Okay. So I would say anywhere between 1 to 3 months after you've completed your program. 3 is really on the long side, but it could be just like, scheduling thing for some people. But really, when you complete your program, you should be within at least a month and a half by then taking your exam. And that's just my advice. But if you feel that you're ready sooner, obviously take it sooner. But if you feel like you need a little bit more time, then go at your own pace. It's entirely up to you. Okay. Next question. Do outpatient coders work at the hospital or just in clinics? They do work at hospitals. They also work at freestanding clinics. That's what outpatient coders do. So, yeah. And the last question, because I'm almost out of time. I have studied in an online program for 9 months. I went to the AHIMA page to register for the exam. Should I have picked the CSA, Certified Coding Associate, or CSC-P? I want to start off easy and work my way up. Am I ready for the CSCP, or will it be too overwhelming? So what the viewer meant by CSCP was the CCSP, which is Certified Coding Specialist Physician Based. That is with the American Health Information Management Association, credentialed through them. And it basically is a coder that is familiar with outpatient coding. Okay. Now, I will point out something else too. The viewer said CSA, Certified Coding Associate. Certified Coding Associate is called the CCA. Now, my point with this scenario is this: when you are sitting for these programs and stuff, it will tell you. And I actually went to the program page that she had gone through, and I screenshotted what credentials that program had prepared her for. So why you would look for other things is no. You need to look at what they're telling you that is preparing you for. And it did say that it was preparing her for the CCA, which is a Certified Coding Associate. You have to get the credentials right. If you're saying CSA, people are not going to understand what are you saying, okay? And then you're going to get even more confused when you look on the website and you don't see CSA, okay? So you really do need to pay attention to what you are reading, what you are looking at, and what credentials are you sitting for. Yes, there's a lot of credentials out there, and when you start with this whole alphabet, it seems really confusing. But you have to get it right. That is something that you can't mess up, okay? And if you're looking on the website, it will tell you what the educational requirements are. The CCA, the Certified Coding Associate, is an entry-level credential, and most programs are going to teach you that. College programs teach the CCS most of the time. Sometimes they teach just the CCA. It just depends on what's going on. But if they're teaching you the CCS, they're teaching you both inpatient and outpatient coding, or the Certified Coding Specialist, just so you guys know. The CCSP has educational requirements which are on the website, or which has experience requirements, and it's also, again, on the website. So these are the things that you need to know. Now, if you're confused about what credential abbreviation is what, Google it. Google it and see what comes up. If the viewer had done that, she would have seen that there is no such thing as a CSA or a CSCP, CSC-P. She would have known that there was nothing like that. So again, it's very important that you pay attention to what your program is preparing you for, what credential exam it is preparing you for. And when you ask them, make sure that it's either between AHIMA, the American Health Information Management Association, or the American Academy of Professional Coders, AAPC. If it is not one of these, then it is probably not what you're looking for, okay? There are other programs. I'm not going to mention them because that's not what I'm promoting, okay? And this is not an ad, but I'm telling you guys, if you want to be competitive as being a medical coder, then you will go through one of the associations, AHIMA or AAPC, because those are the credentials that count. And there's all these other ones that I have no idea where these guys came from. I have no idea what they're about. But if you look at the job listings and when you're looking at under medical coding, right, for medical coders, AHIMA and AAPC is what they're looking for, those credentials. Okay, so that's what I want you guys to know. Okay, it's very important, especially if you are investing a lot of money into what you're doing, okay? And again, make sure that you understand and know what credential you're going to be sitting for at the end. You should know what credential you are sitting for when you start that program. If you do not know, then you need to be asking, okay? Because you need to know what you're working towards, okay? You need to know what practice exam books to get. Because if you feel lost in the sauce and you're not asking questions, the only one that's going to be hurting at the end is you. Because why did you go through that program? You don't know what credential you're going to sit for now, and then now you're not prepared. It's very important to know which one you're preparing for, whether it is through the American Health Information Management Association or the American Academy of Professional Coders. It's important, guys. You have to know this stuff, okay? So, did I answer you guys' questions? I hope I did. And again, I'm going to be honest with you. I hope that, you don't think that I'm trying to hurt your feelings, because I'm not. I'm just being truthful with you, and I'm just saying the things that sometimes people don't want to say. Okay, so again, I just wanted to set you guys up for success. That's all I want, and that's all I've ever wanted. So if you have any other questions, let me know. I will be taking questions, of course, for next week's Q&A Tuesday, and I hope you'll join me tomorrow for Wednesday's episode. And I will go ahead and wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!